I'm Dr. Jean-Kil Chantre, and this is AgeLess. I saw a very concerning stat this week. 61% of adults and 66% of children feel negative or very negative about their body image most of the time. In today's episode, we're discussing this and tackling a topic right at the intersection of health, identity, and modern culture: the hidden cost of a sociological term known as aesthetic labour. This is the effort of workers to manage their appearance and the expectations on them to fulfil aesthetic norms, and also the mirror impact of this culturally from social media. Across film, TV, music, social media, and everyday life, our bodies have become sites of scrutiny and comparison. In my practice with my patients, I repeatedly hear the psychological, physical, and metabolic toll that this creates, particularly for women. The strain of being constantly watched, judged, and compared isn't superficial. It may alter sleep, disrupt cortisol, and even affect the way our tissues repair. And whilst it's easy to cast this topic aside as unrelatable vanity or surface-level pressures, many people feel under stress to be constantly camera ready for social media. My guest today helps me explore the hidden dangers of a system where appearance regularly determines employability, and where the pursuit of camera ready often supersedes the pursuit of health. Research across the screen industries show that 64% of performers are directly asked to change their physical appearance for work, and 1/3 are asked to lose weight. And in an industry where 63% of workers say their job negatively affects their mental health, it becomes clear that it must be a challenging cultural environment. Some of my patients tell me that they absorb this pressure silently, believing it's the price of success, or simply the way the world is. But we actively discuss holistic, compassionate health practices, and this can transform how people feel. And that's why I'm so grateful to welcome today's guest, my patient, Cath Tyldesley. Her journey from dramatic metabolic transformation to navigating industry scrutiny and exploring her why behind medical aesthetics has become instructive, and it's brave. She embodies the very principles this conversation calls for: honesty, social responsibility, and the courage to redefine what it means to age whilst being seen. And please remember to like, subscribe, leave a review, and share this conversation with someone you care about. Cath, welcome to AgeLess. Thank you so much for coming on and joining me here today.
Oh, absolutely. I'm thrilled to be here. Thanks for having me.
I think there's a lot of different topics that we talk about when you come into clinic. And I think the first one that I wanted to address was this topic of aesthetic labour, right? This sociological term that it might feel unrelatable to some people. You know, is it that celebrity, they're successful, they have the financial means to always look attractive and to look beautiful, no matter the gender. But realistically, being under these kinds of pressures from an attractiveness perspective, from a body perspective, can you share with me a little bit about some of the stories that you've experienced?
Those pressures have always been there. I remember going to an audition and the director saying to me, "Cath, you're hilarious. You're always going to be the fat, funny one. You're a character actress." And I was like, yes, I'm a character actress. I can do that. And I love comedy, but I would also love to be a leading lady. And in many ways, him saying that was a positive thing because I was overweight. I was very unhealthy. He could have worded it much better, granted.
Yeah.
But that for me was a real catalyst moment. And that is when I decided to lose a lot of weight and get healthy. And I also remember thinking, actually I love musical theatre, and at the moment I'm out of breath if I walk up the stairs. So I need to get fit and get healthy. And I recognise more than anything now that you have to be super fit in our industry. It's very long hours. Nobody else has got your face. You can't get ill. It's, so I now take those steps to try and be as well as I can be. But I think the dangerous thing now is that level of pressure has suddenly spread, and you've got all these young people looking at socials and going, oh, well, I don't look like that. And they're not even aware of actually the person in that picture doesn't look like that half the time. It's some kind of filter, or I'm not very technical, but some kind of magic.
Yeah.
And then often they can't afford those prices, and they're going to the wrong places for aesthetic treatments. And I'm sure that you probably end up rectifying some of these patients that have gone to these cheaper places and have asked for things, and then the outcome has been poor. It's a huge pressure on this next generation. Which does make me really sad. But I mean, this industry is full of ups and downs. And as you know, I battle on and off with having negative days and positive days.
When I was looking at those stats, particularly the equity stats, around a third of actors are asked to drop weight.
I know.
Did that shock you, or would you say that's about right?
It didn't shock me. And I can be quite method. I can lean into the method side of things at times. And I love changing my physicality, my vocality. I love challenging myself with roles. Yeah. I think it's the way things are worded. Is it necessary for that role? And I think some actors do go to the extremes. You look at the likes of Christian Bale, who lost all that weight.
Incredible.
It's incredible.
Yeah.
And
incredible.
I think it depends on individual cases. But, for that director to turn around to me and say, if you want to be a leading lady, you would have to lose weight. It is outrageous.
It's often a comment, when I listen to my patients, and they'll have a reason and they'll have a fixation on, I need to achieve this, or I need to have, an improvement in this. And I look back, do you remember when, what triggered that? Or was there somebody that said something to you? And normally it's a comment from somebody else that's triggering these things. That comment that was made to you about the leading lady, your future, the career you'd always hoped for, how frequently does it consciously come up in your mind?
A lot. But I think as I've got older and wiser, because I used to be a larger lady, it's no longer about the weight loss for me. It's more about the health side of things. And I've got children now. I want to be on this planet for as long as possible. But in my younger years, it was always about weight loss, and not necessarily in the right way. When I first lost weight, we'd been through the 90s, all the, especially the British press being so negative about female body image. I mean, it was horrific.
It was the norm. It was acceptable.
It was awful, right through to, the 2000s. Somebody like Britney Spears saying that she's overweight, and she was probably like a size 8 or a 10. And I remember thinking, if they think she's overweight, I must be obese.
And you were around 17 at this age. Was it something like that?
Yeah. And I lost a lot of weight, but not in the right way. Being on a cereal diet, firstly, is extremely depressing. You're not getting the nutrients that you need. It's completely unsustainable. But I didn't have the education to know that, which is why I'm always fighting for better education on nutrition in schools. I think we would save the NHS millions and millions of pounds if we did things correctly. And a lot of that stems from my past and from my educational journey with food. Because for many years I battled with faddy diets, whatever the latest celeb trend was, the cabbage soup diet. I think I did grapefruit for a while, and they're all complete madness. And it's only with age that I recognise that now. It was a very dangerous time.
I see a lot of health and wellness discussions and all over social media, where it leads with this, but often there's an underlying tone to it that's around the health and wellness aesthetic. You have to look well. And I've spoken about it before, about this performance around, you have to be up at this time, you have to have done X, Y, and Z by, 9 a.m. and whatever. I'm a little bit concerned at the moment around the rise of orthorexia and how a focus on wellness and healthy foods can become more towards a disordered eating type of picture. Orthorexia, whilst it isn't necessarily recognised within the psychiatric literature as a definitive diagnosis, I think, again, it's part of a spectrum. And I'm seeing it and hearing about it more and more with my patients. I had one patient, Cath, who I've looked after for 18 years. She's in her 40s. And I always think of her as, she's got that beautiful kind of girlish energy, and she's fun and she's lighthearted. She's been through a lot in her life, and she's been quite isolated over times. And there were a few Christmases ago, I was so worried about her. She lost her mum, and if she's listening, she'll know. And her focus on what she was eating started to completely take over. So it was to the level of, she was having her water imported, you know. It wasn't just the alkalization of water. It was, it had to be very specific. Everything was being monitored. And it wasn't necessarily about weight or about her body image and appearance. It was for her health, because she didn't have a safety net. She didn't have other people to fall back on. She was very independent. She is very independent. But I could start to see her health really suffering. And because I'd see her on such a regular basis and I'd known her for such a long time, we got to a point where it was really, really concerning. And it was such a huge metabolic load onto her. But it starts with a focus on the healthy nutrition and a focus on health. And then this became such an extreme example. And I'm happy to say she's now on the other side of it. She's getting much better. She's much healthier, but she has really had to do a lot of holistic work to get back with this. You know, a lot of digging deep, self-reflection, self-compassion around all of this. Tell me what you think about this spectrum of wellness and the risk of orthorexia.
I'm not going to lie. I worry about our food now. The more that I learn, you know, the pesticides, the more that we're educating on ourselves on the rise in cancer, for example, is huge, catastrophically huge.
Yeah, both of us know how many people in our lives.
Yeah, it's crazy. And we have to look at what we're putting in our bodies. So the first port of call is food. And of course, a lot of the time, we have zero control over whether the food that we're eating has been sprayed with Lord knows what. And I think all the convenience foods, the fitness foods, some of these, you know, protein bars, etc., that are massively full of chemicals, words you can't pronounce. And for me, because I have had phases in my life where I've gone, oh, well, I can't put that in my body and that's not organic. Has that been washed? And you can get quite obsessed with it, which isn't healthy. But I think this has become a real trend now on social media. You know, if I spend 5 minutes scrolling, you are bombarded with, you know, do a parasite cleanse because you've eaten salmon. You start to go, oh, what can I eat? What should I be doing? But I think that basic rule of looking how our ancestors ate is, you know, if it's come from the land, you're pretty safe. And that's the best we can do. I just think if you try and eat well and stay active and be outside, I'm such an advocate for that because of mental health. I think you won't go too far wrong with those really basic rules.
Yeah, I agree with you. I really do. I love these aspects. And tell me about your fitness regimes now, and how are you managing to balance all of that with, you know, 2 young, beautiful children and your new role?
Yeah,
now.
It's hard. And again, it was something that in the past I've obsessed over. And if I missed a day at the gym, I'd be freaking out. I no longer have that mentality.
Okay.
I do what I can when I can. Going to the gym or being outside or swimming or outdoor swimming, it is really important for me. And I do make time for that. And again, it's not really about weight loss for me now. It's about being strong. It's about being fit for this role. You know, the hours at Coronation Street, like a lot of my other jobs, are really long, and you have to have really good stamina. And I've got 2 young children, and stamina being the key word there.
Now that you are feeling more balanced around the nutrition and the food side of things, and you feel more stable in terms of like weight and body image, have you got any tips for people who might be listening who do still feel those pressures or are really hard on themselves or have had really negative comments from others?
I think, I'm a big fan of the 4-pillar plan, Dr. Rangan Chatterjee, as you know. I think he's fabulous. And those basics of turning your phone off, initially just for 20 minutes, then the next day turn it off for an hour, and then, hey, who knows, you might turn it off for 4 hours, is so liberating. And we will often do that, especially when we're with the children. I will say, right, I'm not going to have my phone this morning. And, you know, I think it has a massive impact, you know, the things around you that you are seeing, and you have to focus on what is important. Are you strong? Are you healthy? Are you able to look after your children? I want to still be going on bike rides when, you know, I've retired. I want to be as active as I am now when I've retired. And so those are the things that I'm trying to focus on. I try to shut out the noise as much as I can. It is very prevalent in my industry. But I feel that my family helped to keep me grounded. Tom helps to keep me grounded.
Yeah, beautiful. What about the pressures on different genders within your industry? I did find a stat in terms of gender burden that was saying that 72% of women in your industry felt greater appearance pressure versus 28% of men. What are your thoughts on that?
I think, to me, it's the same in a lot of industries. It's like once women get past a certain age, a lot of my friends that are older than me, they'll say, I feel invisible. Whereas guys seem to be able to carry on working no matter what age they are.
Yeah.
But I do think in this industry as well, when you're in the public eye, you are massively scrutinised. I know actresses that have had full-on surgery because of comments they've received online.
What kind of comments? Like what anatomical areas and what kind of surgeries?
It was arms, face, stomach. This person ended up having a lot of work done unnecessarily. They were so beautiful and still are, but it made me really sad. I don't think people realise the impact they can have when they post negative comments. You know, these people that are in the public eye, and actually there's several people that come to mind in my life that have been so hugely affected by it. They absorb those comments, and it can really have a life-changing effect on that person, which is why it's so important to be kind to each other and kind to yourself and to try and shut out the noise. You see the most ridiculous things online. And again, the British press can be extremely negative towards body image. Not as much as they were in the 90s, perhaps, but it's still there. It's subtly still there, especially with women. It's very sad.
I can't imagine how difficult it must be, actually. And when you say to cut out the noise and to be kind to yourself, and you know, you see it on socials with commentary around, oh, you know, why are people still talking about, why are women still talking about aging? Why are still talking about body image and appearance? But then at the same time, you know, why does she look so big in this? And she's put weight on that. Or she's gone too skinny. It's that constant dichotomy of both and the extremes of both. And it's...
and there's everybody, people like Margot Robbie, after she just had a baby, and she looked incredible and beautiful and glowing, and she just produced a human. And the comments that she was getting, game over for Margot, she looks terrible. It was astounding. I mean, I had it after I had Alfie. People, oh, she's not lost the baby. Same with Iris.
Did you?
She's not lost the baby weight.
Yeah,
she's let herself go.
This,
She looks knackered. Yes, I look knackered. I've just had a baby. And it is hurtful. Of course, it's hurtful. But the older I've got, the better I've got at going, this is ridiculous. And, you know, the people around me, including yourself, that will say, focus on the things that are important. And also feeding that inner beauty, which is, you know, why I've been such a long-standing patient of yours and we've become such great friends, is because the way you encompass humans as a whole is incredible. You know, starting from within and looking at every aspect of why somebody feels the same way, why somebody feels a certain way is wonderful. And it's, you know, I will forever say hats off to you for that.
This episode is sponsored by SkinCeuticals. I performed the clinical research and launched PTOX peptide serum by SkinCeuticals to the medical community. Along with my international colleagues, I published on the real-world impact of PTOX serum. We found that it targets lines caused by repetitive muscle movement, as well as smoothen other more difficult to treat wrinkles. With a precisely calibrated blend of peptides and PHAs, I use PTOX personally and with my patients to help soften lines, refine skin texture, and boost radiance for that luminous glass skin finish. You can redeem an exclusive 15% discount on PTOX serum at my clinic. Follow the link in the show notes for more information. I remember some of the beautiful moments we've shared in the studio together. Do you remember one of the mental health forums that you came to? And we were actually educating around antioxidants and the benefits of, you know, food nutrition in terms of antioxidants and then topical antioxidants and what to look out for in terms of the skincare noise. But it just exploded, didn't it, into this incredible safe space where, again, there were many people in the room who, you know, are on in terms of the media and in the public eye, and people were just really opening up about their own stories.
It was amazing.
Incredible, very special.
But that you do that so well, bringing, especially women. I mean, everybody. I know you look after a lot of males as well, but that room that day was predominantly women.
Yeah.
And when you bring strong women together like that, it is fire. And we need more of that. And it was one of the most special evenings that I've had, actually. You could feel the uproar. You could feel the rebellion. You could feel the need for the correct education, which, again, I know you are really at the forefront of, because there's so much misguidance out there. Yeah. It was amazing. Yeah.
Yeah, it really was. And I think people might think, you know, it doesn't make sense, the fact that I've been working within, you know, cosmetic surgery, plastic surgery, medical aesthetics for my entire career. Wait, is there a disconnect? Does it seem right that I'm also such an advocate for mental health and for positive body image and etc.? The reason why I continue to do what I do is because of the stories that I hear every day, you know, in just normal life, the impact that it can negatively have. And then I'd love to live in a world where nobody had to have anything done. I really would, you know, where there wasn't these pressures. But the reality is that there are the pressures. And actually, by helping people to holistically, in a 360-degree way, look after their skin, make better health choices, you know, have some assistance from some medical aesthetics, it is the reason why I can continue to do the job that I do. I think of some of the other actresses that I treat, particularly actresses, actually. I think it's myself, the passport office, and that's pretty much it, that actually know their real age.
Oh, wow.
Their husbands don't know their real age, and unless they've maybe seen their passport. There might be a couple of my actresses that might be listening.
Are we about to tell people I'm actually 75? No, I'm joking.
Oh my gosh. And some of them, the extreme stories they tell me that, you know, they are not allowed to age. And when you said about the invisibility, and I don't know what the age seems to be in terms of the performing arts, but it seems to be very early 40s. It's like around that time, right?
Yeah.
And then suddenly you become typecast and you're just not allowed to show any forms of aging whatsoever. And yeah, it's pretty brutal what I'm hearing. So when I hear this, there is some degree of difficulty that sits within me, because I'm like, I really wish that we didn't have to be doing this. But in order to keep them going within their careers, we do have to take steps.
I think that's what is so brilliant about you, your ethos, your clinic, is you look at an individual's needs. You know, you look at an actor, and I know some actresses aren't as bothered about being able to move their face, but I know that we've had many discussions about this, and I'm like, I look at somebody like Kate Winslet.
Okay.
And full facial movement, glorious. She looks incredible.
You can feel that emotional connection through the screen.
She tells stories. Like, I mean, for me, she is one of the leading actors of her generation. I just think she's incredible. But I love the fact that you sit with each patient and say, okay, well, if you don't want to do this, let's do this. If you don't want to do that, let's do that. And you always give people an option, but whilst also looking at the mental health side of things. That's what really struck me. Even when I first met you, it was the why. Why?
Yes.
Why? Whereas when I've been to places before I met you, it was like, I think we should do this, I think we should do that. And they would point out things. And I'd be like, oh, does that not look right? Is that, and I'd be like, oh, and it was all about the money. They didn't care about the patient. The way you encompass the whole human being is amazing.
Thank you.
It is. It's amazing. And I don't see anybody else doing it. I just think it's wonderful. And it's testament, that is why your patients stay with you for such a long period of time.
Yeah, I'm very honoured. And, it is hard when you see a lot of marketing around holistic aesthetics and cosmetic surgery. And it's like, is that really real? But the why is absolutely crucial. And going back to what you just said about expression and the connection with emotion and how we connect as humans, again, that's a real fundamental thing that's been really crucial to me in my practice. So because I've always treated so many actors, for me, understanding expression has actually then translated into how I treat every patient that I see. Wow. So again, of course, if I'm seeing, an actor and actress where you've got an incredible role coming up, and I'll say to you, what are some of the crucial stories and emotions that you're going to need to transmit? Well, then of course your face needs to be able to embody that. And I know that when I watch actors and actresses on screen and there is nothing moving, there's barely even a micro expression.
I just switch.
I find it really difficult.
I completely agree. I completely agree. And they might look absolutely beautiful, but it's not my, again, comparing it to somebody like Kate Winslet or Judi Dench, Sue Johnston, who I've had the pleasure of working with a few times now. Oh, just the way they tell the story.
And it's doing justice to the art of what you're trying to portray, but also considering medical aesthetics and how that fits is really, really crucial. And like I said, people who aren't even on screen at different times in your life, at different moments, what is it actually that you're trying to achieve? And maybe your goals will vary and alter at
I
these
think
different
they do
moments.
change. When I first came to you, all the problems that I was having with my skin, for example, I feel so much more educated now on my skincare and the importance of it, and the treatments that we've done, and also making it a regular thing, making time for myself to come and have a facial, and especially before I start filming again. It's really boosted my confidence way more than I ever could have imagined, actually, because I sometimes used to look at the screen and go, oh, my skin looks terrible. And it has a massive effect on my confidence, huge effect on my confidence.
That's really good to hear that, you've had that positive journey.
Oh, for sure. And everyone comments on my skin.
Yeah.
And I'm always like, thank you.
I think back to when I first met you, and actually it's so common with so many actresses because of the screen makeup.
Yeah.
And the stage makeup.
So heavy.
And all the different, so all the things that are being plastered on, and then the primers, and then this to make you look dewy, but then need to mat you down, and then it becomes layer upon layer. And the amount of actresses that I have met who, when they first come to see me, it's like, how do you wash your face? Well, I don't really, I'll use a wipe or whatever, and then, I get a bit nervous. But because my skin really reacts really fast to everything. it's reacting because it's become sensitized. It might not even be sensitive. You might not even have a skin disorder or a disease, but the sheer level of chemicals that are coming on and off your face, plus in between and every night when your skin's recovering and repairing, actually washing your face appropriately, using some basic actives and some, really clear steps that will help and be bespoke to your own skin. It just is so quick how we can transform. It can be within 4 to 6 weeks.
Yeah,
but it's extremely common, isn't it? And I think we've done a lot with your skin over the years and at different time points. So I think having those monthly, when we can, those dermafacials, that's really helped in terms of your skin function.
Hugely.
And the longevity of your skin.
Yeah.
And, the health, you talk about like the health insurance of how you've seen medical aesthetics and skin health be part of your own health insurance. I think that's been key. But obviously we've used radiofrequency for skin tightening. We've used microneedling with radiofrequency, particularly around the times when, around the time of iris.
Yeah.
Obviously not when you were
really
pregnant or when you were breastfeeding, but...
I did feel, I guess it's hormones as well, isn't it?
Exactly.
After giving birth, my skin just really kind of didn't know whether it was coming or going. And I remember phoning you and saying, I need some help. It's kind of all over the place. And we need, and we looked at my skincare routine again. And I suppose your skin does change over time and it needs different things. I've noticed my skin suddenly started to get drier the older I got. And I think it is about, again, education. I didn't know about, some of the treatments that you offer I hadn't heard of before. And I was worried about the downtime. But with a lot of the things that you offer, you find the next day.
Because of the sheer number of actors and actresses that I've treated over the years, I had to get really sharp and on it in terms of reducing downtime, making sure that there were absolutely no signs that anything had happened in terms of treatment. I mean, honestly, the pressures I have been under in terms of people have got the BAFTAs the next day or
oh my word.
I remember like working out in LA and like pre-Oscars. It's about being very fine with it, very light-handed, not doing anything that isn't necessary. And planning things out throughout the year. As you say, there's a seasonality as well towards skin and how like your face and your body actually behaves over time. I think back to the time around iris and how did you feel in that postpartum period?
I did struggle more after having iris. I did feel a bit of a pressure. To get fit again. Again, not so much about the weight loss, but I need to get fit. I felt very vulnerable. I felt very weak. I was unable to train with Iris, whereas when I was pregnant with Alfie, I was weight training till I was 8 months. With Iris, I did very little because I was so poorly. So that did impact me massively. I found postpartum very difficult after Iris. And then, of course, I remember my agent phoning on a Wednesday saying, are you still breastfeeding? Because you could move to Malta on Friday to start this new series. And I remember thinking, oh my word, it was such a fast turnaround. And we got through it. We got through it as a family. And as you know, in terms of my body, there were areas that I really struggled with after Iris that I hadn't struggled with before. My lower abdomen.
Really
I know it came to you about that. And my hips, which I hadn't stored fat per se there before, but I just felt my body change dramatically. And it did impact my mental health for sure, because I had got into the rhythm of feeling strong and feeling pretty confident most of the time.
We tackled those areas of stubborn fat after Iris and the new areas that you were seeing, the lower abdomen and the hips when we did those treatments.
And I think it just helped to calm things down, and I for sure noticed a difference.
The treatments that we did, one of them, it can be up to 40% in some patients of the fat cells permanently from those areas. And again, it's really common in all sorts of different genders and ages, but particularly in women who have had pregnancies or are perimenopausal or menopausal, and they're noticing these new areas of fat deposition. But that permanent fat loss in that area can really, really help.
Oh,
But,
definitely, especially on my lower abdomen.
yeah.
Because that rectify, I didn't think it was ever going to go away.
Obviously, you're in a new role. It's an iconic role.
Yeah.
As landlady, as
Thank you.
Eva. Congratulations.
Thank
I love it. Moving forward, she is very glamorous and isn't she? She's kind of girly, glamorous.
Yeah.
fun.
Feisty.
There's a lot of outfits and
There's a lot of there's very skimpy outfits. Yeah.
So we're focusing a lot on your skin, right?
Yes.
Still. So
Yeah,
we've changed the game a little bit. We're doing platelet-rich plasma. So we're taking your blood, we're getting your own growth factors stimulated from your platelets, injecting it back in, using multi-layer approach, skin, fat,
It's amazing.
different dimensions. And that is so critical from a regenerative perspective.
Yeah.
So, that proactive, preventative perspective as well. And then I know that you've had a lot of comments from the glass skin treatment that we did.
Yeah. I feel like it's really nice for me to be back in Manchester and get to see you more often and introduce new treatments. And for sure, my makeup artist's like, what are you doing?
Yeah.
And my makeup is sitting so much better. My skin feels stronger, actually. It does feel stronger because, again, like you were saying with other actresses before I came to see you, I didn't really have a proper skin routine. Lord knows what I was doing to my skin barrier.
I see just absolute crazy skin barrier behaviour. And I've seen it on you a lot, actually. Just even when different makeup artists have been using different things, I can see a difference in your skin month to month. That's why we decided to start to use a little bit of Skin Vive with you for the direct hydration as well. Because with time, if you start to lose more hydration from the skin, again, that impacts the whole functioning, skin firmness and your skin health. So that's definitely been really positive. And there's really strong science behind that. I did the clinical trials in France. We published really strong clinical data on that, where actually just from one session, you can get 9 months of actual hydration into your skin. So you're not having to put lots of heavy moisturizers on your skin that can disrupt the skin barrier and turn off your own cells, thinking that it's getting sufficient hydration from above. But actually, we inject it directly, hyaluronic acid, directly into your skin where it needs it. And then we get your cells actually functioning better. So
I mean, again, it's incredible. And I'm so glad you've explained that because I have so many makeup artists going, so what is it? What does it do?
Yeah.
And my science isn't your science. So they'll be able to listen to that and go, oh, that's how it works.
Yeah.
But yeah, just incredible. The difference. And obviously I know some of your other patients as well. And the difference that you've made to them is...
Thank you.
Incredible from from all walks of life and for in terms of their body and face. It's the way you empower people is amazing.
Thank you, Mav. I really appreciate that.
Yeah, it's true.
Speaking of empowerment and our shared mission of social responsibility that come from our mothers.
Yes, very much so.
Most definitely. I want to ask you about the next generation, both of performers and in terms of, the general public. Where do we go with all of what we've talked about today? What are your concerns and what are some of your hopes?
I think we do have a massive responsibility towards this next generation. There is so much noise out of there and a lot of that noise isn't great. It's completely unfounded. And I think we need to establish things with education, first and foremost. But the language that we use, I try to be very mindful of the language that I use around my children and really encourage that beauty from within. It's all well and good me saying to Iris, oh, your dress is so pretty. But I think it's important to say, Iris, you are so clever. You are so clever. You are so funny. You are so talented. You are so kind. And, to use language like that, hopefully that they will continue to use language like that as well. And and look at things as a whole.
I think we've been very lucky that both of our mothers, it wasn't about what we looked like. I know that, in my childhood, it was, what have you got to say?
Yes.
What are you going to do? Okay, what am I going to achieve? But how am I going to help others?
Yeah.
And, I have to thank my mum for that. And I know that Janet is absolutely
They're very similar.
like that.
Yeah.
To your point around language, so I've seen like grandmothers and how they self-speak. So, am I fat in this? Oh, it's terrible how I look today. I look so tired today and this looks awful on me. Oh, I need to lose some weight. Oh, my hair looks awful. And I hear it, and I've always tried in my clinic to, again, as you say, it's not false. It really isn't. I'm always looking for things to help people to the more positive self-talk and not in a toxic, empty positivity. But then when I started to treat their daughters and I hear the same patterns, I wouldn't necessarily see their mothers saying it to them. I might not witness that, but it's the observations that we learn and those things of watching, isn't it? Of in the mirror and doing.
And I would be heartbroken if Iris, sometimes I will look at myself and go, oh, I look fat. I remember Iris lying on my tummy and saying, it's so squidgy, mummy. And in my head, I was like, oh, I've got a squishy tummy. I'm not toned. But I turned it around and I was like, isn't it comfy? You can't lie like this on daddy, can you? Mummy's like a little soft pillow. And I was like, you know what? This is great. Yeah. It's really positive. Mummy has got a soft tummy. I've had 2 children. I've done incredible things. My stretch marks and my jewellery, they're my reminder of having babies. And that is a wonderful thing. I think it's about teaching them to celebrate those things.
I know you've said it before. You're an instrument, not an ornament.
An instrument, not an ornament. Love that.
Yeah. I have one last question for you. What does feeling ageless mean to you?
The first word that popped into my head was boundless. It is my belief that you can have anything you want from life as long as you work hard. And I don't think age should restrict that in any way, shape or form. That's what it means to me.
This has been really powerful. It's been really important. And I am so grateful to you.
Likewise. Likewise. Thank you so much.
I'm super grateful to Cath for sharing her story, as it brings into focus the unseen metabolic and psychological pressures that so many actors and performers live under. I think there's a lot to learn from this industry for how social media and the pressures of being camera ready can have on so many people who never wanted to be on show or on video, but now find themselves keeping up with social media. The pressure of aesthetic labour by brands and companies also shows that these are outdated conditions of employment. Cath's journey also reminds us that focusing on health and self-worth are practices that we continue to cultivate through every stage of life. One point I'd like to make today is that you deserve to feel safe and powerful inside your own skin, not dictated by society's expectations. And I totally realise that this sounds idealistic and it sounds obvious. But after treating thousands of patients over 20 years of wide age ranges, having that robust self-image, no matter what, definitely isn't as straightforward as it seems. So here are my practical takeaways for this episode, inspired by Cath's journey and the principles of self-respect and metabolic truth. Number 1, redefine your positive aging needs for the chapter that you're in. Cath's story shows that our bodies require different things at different times. This week, ask yourself, what do I need at this stage of my life for my body, my mind, and my soul to feel aligned? It may be actively scheduling in non-negotiable 15-minute quiet periods, or giving yourself permission to take a couple of hours out of the week to learn a new activity that you enjoy that doesn't have the hidden goal associated with your weight or your body shape. Your needs evolve, and redefining them is a powerful form of self-agency. Number 2, with the current body trends of skinny talk and the impact of rapid weight loss medication for aesthetic reasons and not health, as a medical doctor dealing with self-image, I'm closely watching the impact on disordered eating rates. If you think you might have disordered eating or an unhealthy body image that's impacting your mental and your metabolic health, please find someone you can speak honestly to. This can be the hardest, but the bravest step. If it isn't family, friends, or your GP, confidential support is available through charitable organisations, and we'll put links in the show notes for you. If you found this conversation valuable, we'd be grateful if you could please subscribe, share it with someone you care about, and let us know the questions that you want answered in future episodes. As a thank you for being here, you can redeem an exclusive 15% discount on the one dermafacial that Cath's had and a complimentary skin consultation with my team at One Aesthetic Studio as a positive step for your skin health. Simply follow the link in the show notes and enter the code COURAGE15 at checkout. Together, we're redefining how we age, look, live and feel. I'm Dr. Jean-Kilchantray, and this has been Ageless.